to Miss Naume Kusotera now. We talk about health starting at home. How is it so?
Thank you. I'm glad that my prophecy came true. We had a small chat when I just entered, and I said, "Oh, you are the MC or the host," and you were saying, "No, I'm not." But I'm seeing him holding the mic now.
Thank God.
Thank you all for having me, us here, and discussing this. Ruben, congratulations. I can't see where you're seated, but I can see your parents. Congratulations. For putting us in a space where we can talk about certain things that sometimes we may not ordinarily have that time to talk about it. When we talk about health, it's not the absence of a disease. We are looking at the mental, the physical, the physiological state of a being. We are looking at the ability of one to be able to cope with the stresses of life, going through life, managing it, but under the stresses of life. Ladies and gentlemen, do you know that stress doesn't care whether you live on the north or the south side of Samora? It doesn't care. It will come in one way or the other. For one to come to a place where we can say they are healthy, they're able to go through life regardless of those stresses or pressures that they meet in life, and they have the skills and the tools to be able to know how to be able to navigate under such difficult and different circumstances they may be able to find themselves in. Home is a place, or I would like to say a family, I would like to say a community. That is a place where we make a positive contribution. Or that place where we feel belonging, that place where we come together with other individuals. And yes, the family can refer to your primary place where you were born, and that's the home. It can also be different communities where you make positive contributions in. It can be here, it can be church, it can be with friends. So let's look at health in all the different aspects, because all those different communities, they affect us in one way or the other. Home is where we have certain habits, where they are molded. And I like to use the word molded. Learning how to check up on each other, to ask, how are you? How was your day at work? How was your day at school? That's the place of connection. And that is actually where health starts. I remember myself growing up, whenever I would come from school, after having a stressful day, my father would ask, what happened? Because by the mere effect of him looking at me, he knew something was wrong with my daughter at school. And where we talk about health, we talk about that connection, where we are able to check up on each other as a family, starting from the home, starting from the family, and it building into communities, and it building into our nation. Home is the place where we learn how to relax, how to wind down, how to care for ourselves. What are those habits that we do as a family that help us to be able to wind down and leave the other pressures of life? Is it we come together and we talk? Is it we watch a movie? Is it we go and we visit our sekuru, our tete, our mbuya? What is it that we do at home where we are also just intentional to just wind down, to relax, to rest, to nourish, and to take care of each other? Yes, we can talk about the medical side of health, but today I want just to talk about the soft things of life, because those are the things that usually just affect us, Where we are sick and maybe it's a leg that's hurting, you go to a doctor because the pain is a bit unbearable. You know what to do. But it's those small, soft life things sometimes that we don't know where to go, and they greatly, greatly impact home. So yes, health starts at home. Health starts with the habits that we form at home, the things that we model after, the patterns, the things that we even teach our families, our children, connecting with each other. That is what health is. And yes, it does start at home. Thank you.
Thank you. That is insightful. If we say health starts at home, in Africa, I'm an African. We always talk from the African point of view. Mm-hmm. We've got families that, the way people get resources, mm-hmm. Some are rich families, some are poor families. Mm-hmm. As a pharmacist, what exactly can you say is a basic health practice that families can take regardless of how they are resourced?
Thank you. You've just put it into my area of mental health. Regardless of the financial status that you have, with your family. The best health advice that I can give is connecting, coming together as a family. Do you know, we are created, wired to connect. And we thrive when we are in communities, in families, because that is where our strength, that is where our power as people come in. Do you know, the moment that one is out of a community, out of a family, they're like, I want to give you an analog of wild animals. I think we've seen it in documentaries, where maybe a lion or a predator is chasing after a prey because they want it for food. Which animal do they chase after? Anyone can shout out the answer? Thank you. The one that's outside of the pack, because they are alone, they're outside of a family context, they're outside of a community. And you know what also comes? Putting it into context, diseases, they come. Your depression comes because you're outside of a community. Anxiety comes because you're outside of a community. There's no one sometimes that's there checking up on you, either by taking yourself intentionally out or you don't know how to plug yourself in. So the best health advice I can give anyone, regardless of any financial status that you may have or be in, is to connect. Find a place where you belong. Find a tribe where you belong. That can be your primary family. That can be work. That can be church. Whichever community that you find yourself making a meaningful contribution, connect with it, because you need it for you to actually be able to make it in life. Thank you.
Thank you.